The World Health Organization has declared the ongoing outbreak of Mpox in Congo and elsewhere in Africa to be a public health emergency of international concern. It is the highest level of alarm issued by the WHO and the second time in 2 years for Mpox. This week, the WHO says there are cases of Mpox in more than 15 African countries, as well as Sweden, Pakistan, and the Philippines. As the world battles the Mpox virus, observers say the surge is exposing the world's most vulnerable. According to UNICEF, children are at significant risk, and the new variant adds extra burden for families living through conflict and displacement. Vincent Makori has more.
Justine Munguiko could not recall the name of the disease she had been warned about. She just knew her baby was suffering when sores appeared on its feet and hands like other children at the displacement camp near the eastern Congolese city of Goma. Communities like Munguiko's are among the most exposed and in need of support. She and other mothers at the camp decided to treat their children a traditional way for dealing with fevers and rashes, washing them in boiled salty water and rubbing their skin with the soft leaves of kitamatama plant.
Magonjwa kuhusu hii magonjwa hivi upele vya kawambi si walituambia aseme kama ni magonjwa gani hii majina miele jina ya ile magonjwa mimi sikumbuke njome walisema ni kukula kama nyama ya pori jina leta hivi nani.
As the international community scrambles to source enough vaccines, Munguiko's experience highlights the amount of work that needs to be done to make sure the most vulnerable in Congo and elsewhere have the right knowledge and resources to protect themselves from the viral infection that is usually mild but can kill. Communicating with people about what they should do is critical.
We need to get the right information out to the people who are immediately at risk as well as those who are likely to panic. Communicating with people about what they should do, what they should report, and how they should report so we can understand what's going on quicker and contain it better is critical. But long term, so that we don't have the same conversation again next year, the year after year, we need to ask ourselves, how do we define public health emergencies of international concern? When do we define them of international concern?
There have been around 27,000 cases and more than 1,100 deaths, mainly among children in Congo, since the current outbreak began in January 2023. The virus has also spread to nearby countries. At Kinyarushina camp on Monday, residents gathered in an open area between the rows of tents to hear a health worker from aid organization Medair explain how to avoid infection. They received a colorful leaflet with pictures showing the risk of close contact with infected animals or people. The challenge in Congo and other African countries is compounded by a lack of funding for research.
The first time Mpox was identified in countries was, in fact, in Central and West Africa in the 1970s. So 50 years on, there has been a shameful lack of investment to support researchers in African countries to really understand Mpox better. We still globally do not have a good understanding of Mpox, on the outbreaks, how it spreads, how many asymptomatic cases do we have for every case that we find with symptoms. We do not have a good understanding.
To effectively protect against Mpox, the WHO has initiated an emergency use listing procedure, EUL, to help countries with regulatory reviews of Mpox vaccines. It also enables UNICEF as well as Gavi, the Vaccine Alliance, to quickly procure vaccines, speeding up the process of getting safe and effective vaccines into the right hands. Vincent Makori, VOA News.